This is the time for the annual State of the School address. We just had a very interesting alumni session on innovation and patenting. And there were a number of members of the class of 1980. Did they come in or did they leave? I forget where they went. Sam Young's still here. And just to maintain the history, one of the graduates, George Axe, who's a bit of a character and was the head of pediatric dentistry at the, I think, Washington Children's Hospital for many years, presented me with 2 plaques that said Douglas Atwood, clinical director, okay? Doug Atwood was a noted prosthodontist here, passed away several years ago, and he stole them. Because he wanted to be like him. And so he thought this would be an appropriate, what is this, their 25th anniversary? Yeah, 35th. He presented it to me. But the really good news is the state of the school is fine. And the state of the school is fine for a number of reasons. Those reasons are a tremendous administrative support staff, continued marvelous students who we don't ruin, a wonderful faculty that comes and goes, unfortunately, and creates problems for us at times, but I guess our lot in life is to produce faculty that are really good, and then they go off and work somewhere else for various reasons. But since we think there should be a balanced life, it's hard to keep people from having important partners, spouses who want to move at times, and that's what happens. But the state of the school, really, I can say, is good. The budget is balanced. We've succeeded in reaching already a number of the goals of our last strategic planning process, which began now 2 years ago. Began 2 years ago with a appropriate strategic planning session that we held at the Innovation Lab over in Alston. One of the innovations we introduced was a pledge that all department heads buy Powerball tickets when there was a big payout, and would give 20% to the school for scholarship endowment. I'm not sure everybody's done it. Someone's done it, but no one's won yet. But that would be a tremendous innovation. I just want to point out, while I get this, that as part of that strategic planning process, we really changed our mission and to transform dentistry by removing the distinction between oral and systemic health. And although we've done some of this through curricular change and through various other methods here, I'll talk a little bit about what's now been termed the initiative the Harvard Initiative to integrate oral health in primary care, that we see as a next direction for the school and something that will inform everything that we do here. So this is our updated mission: to develop and foster a community of global leaders dedicated to improving human health by integrating dentistry and medicine in the areas of education, research, and patient care. And our updated vision is the one on the previous slide: to transform dental medicine by removing the distinction between oral and systemic disease. There are certain things that probably should never have been separated. Some of the results of questions like that we're seeing in the Middle East these days, but the other area we see it is that the mouth tends to be separated from the rest of the body. We don't believe it, we don't practice it, we don't educate that way, and we really need to do some things to try and alter that, especially with the growth of new dental schools, in the face of tremendous needs and problems with access to care. So these were the strategic initiatives that we came up with in that planning process. To strengthen the research infrastructure, we've done that through some resource alignment for animal care and other kinds of issues related to research support, to create a blueprint for curricular change that's now coming to the fore as the medical school curriculum is changing, and we'll talk about that. Is Sang Park in the audience? No. She's been instrumental in taking us through that. To innovate in patient care delivery, which we're doing with the use of easy codes and electronic health records. Certainly to raise the profile of the school within Harvard University. And I think we've had some success of that. This is my 22nd year as dean, believe it or not. I say that I do the job part-time because I still see patients and do some teaching, but it's been my honor to lead this institution because it's the kind of institution whose history is consistent with everything that needs to happen in the future. Now, sometimes the status quo for an institution is the wrong thing, but in the case of the Harvard School of Dental Medicine, the status quo is the future for the rest of the profession, and that's one of our important jobs. I joke that probably now about 80% of the university knows that it has a dental school. That's up from 1992 when I became dean, from about 40%. We've also had a plan to increase revenues, and we've talked a little bit about that. We also wanted to hire a vice dean, and we did that. John De Silva was chosen about a year ago to be the new vice dean. Unfortunately, John's on a personal trip right now and couldn't be with us. This is the first graduation he's missed in 30 years. He was presented with an award the other day and sent some remarks and really was very sad. The first one he's missed in 30 years. But I talked about the importance of our administrative infrastructure, and just to remind you, all of these people are in the room. Charles Frizzell, Dean for Administration and Finance, who's done a superb job for the school and can be tough when he needs to be tough and can be understanding when he needs to be understanding. But if I'm too understanding, he's on the side of toughness. So thank you, Charles. Kevin Dolan, Director of Human Resources. Who would have thought 20 years ago that we would have needed a Director of Human Resources? Who would have thought that we would need a Director of Risk and Compliance? And Stacy Kane joined us this past year. We talked about John. Nancy Jones came on a little more than a year ago and has really elevated the activity as Associate Dean for Development and Alumni Affairs. And Heather Denny only came on recently as Director of Communications, and that's something that plays a very important role. I've had a number of very nice comments on the publications that we're putting out and the programs that we're putting out, because if you go in the lobby when you come into this new building, there are two heads out there, heads of Guys, Dr. Guys, who was the author of the Guys Report, which came out in 1926 and really altered dental education and dental practice and dental research. The one on the far side, the school got for innovation. The one closest to us is one that I just presented to Dr. Gorelnik, who's here in the front office, for all that he's done for dental education and the profession. But the important thing about this is it probably is time for a new Guys Report. I think the landscape for the profession has changed tremendously, and I'll talk about a few of the kinds of changes that are taking place. So there are several searches that are going on. One that is near completion is a search for a new head of oral and maxillofacial surgery. Dr. Leonard Caban, who's not here today, is stepping down as head of the department and chief of the service at Mass General Hospital. He is not retiring, but this is part of a transition at the hospital. And there are 4 finalists for this job, and this is a lousy one, isn't it? And and that decision should be made sometime in the early summer. We had a search for restorative and biomaterial sciences. There were at least 15 candidates. Dr. Howell led the search. There were 4 names suggested to me, and as of last week, I'm proud to say that Dr. German Gallucci has been named department chair and the Raymond J. and Elva Pomfret Nagel Associate Professor after a global search, and there were global candidates, and I'm very pleased that he accepted. He's right here in the front, and I think he will do some very nice things. We, as I said, have lost some really important faculty to other schools, mainly because of spousal commitments, and so we are searching for those positions in the dental practice and in the dental clinical areas, and also have searches for senior tutors, which are critical individuals in our educational system, where the students are arranged in clinical teams. And I think we made one offer, I think, St. Paul told me, to someone, but still have one position open. But it is a profession in transition. Dental benefits are eroding for adults. Benefits are increasing for children, a la the CHIP program. Access to care in any number of these kinds of programs is not being addressed. The real question is, will dental benefits become part of medical insurance plans? That's something that we've been working on. Oral health for an aging population. Oral health dentistry was never included in Medicare. It was an organized effort to stay out of Medicare, probably looking very good at the time, staying a fee-for-service, especially with the issues that Medicare has had over the years. And in fact, the direct effects of that were dental schools were the direct beneficiaries of that, with many sons and daughters of physicians applying to dental school rather than to medical school because there was less regulation. But that too will change as our elderly population increases. We need to increase value and reduce costs. And there are lots of opportunities to raise the profile of oral health. It's in this landscape that we're looking to offer some unique ideas that usually don't come out of the dental profession. Not that it isn't a great profession. I'm very optimistic about it, but change is always hard. A change, especially in a landscape of our country now where economics is a huge problem, where agreement and bipartisanship is a big problem. So one of the things that we're talking about and looking at is engaging dentists in primary care networks via interprofessional collaboration. Interprofessional education is a big buzzword and has been in the past few years, but we'd like to extend that to interprofessional practice. There's provider consolidation. There's growth in large multi-site practices. Only last Thursday or Friday, when was that, Amy, that I went to a meeting sponsored by the Eastern Dental Insurance Company, which is a big insurer on dental insurance, malpractice insurer on the East Coast, which was all about dental service organizations, which have grown tremendously. And these are not only the Gentle Dental and Aspen Dentals, these are Pacific Dental and some very, very unique and forward-thinking groups that have put together practices with practice owners and managers and provide the business side to practice, very much like our original thought of the faculty practice here, where we thought people would run to practice where they wouldn't have to deal with the business side of things. But this meeting brought up a number of interesting things. This DSOs now really represent about 20% penetration in the United States. And one of the issues that they are impacting is what young graduates do, because they offer very good salaries, often over $100,000, $100,000 to $150,000 immediate graduates from dental schools, not with general practice residencies. And they offer a lot of in-house continuing education. In my own mind, some of them even represent interesting alternatives to a general practice residency, where they may be paid $30,000 to $50,000, by general medical education funds. But if someone would develop these in an interesting way, I think they pose a threat. And I've always been a great believer in the fact that a dental school graduate is not ready to practice, that they should have a general practice residency or some further education, much like our medical colleagues. There was a statement made that dentistry is the only profession where the degree is awarded before they're ready to practice. And I think this is true, but DSOs represent both an opportunity and a threat where these things are concerned. There's also continued interest in mid-level providers, that is dental therapists. Maine has passed a law to allow this. Vermont is coming back to provide it. Just last week, I was at a meeting at the State House called by one of the senators who was promoting a expanded duty hygienist role. There are already public health hygienists that are working. All of this to reduce disparities and improve access to care, because we all know there are issues in taking care of patients because of reimbursement issues, i.e. you get paid so little to take care of a mass health patient in Massachusetts, and this is true in many, many other cases. And certainly the Affordable Care Act is having interesting effects on the practice of medicine and soon the practice of dentistry as well, even though you may not want to hear that. So I think all of these issues need to be addressed. Commercial plans are increasing the use of selective networks and demand increasing accountability, because accountability and value is something that insurers are looking for in a great new way, so to speak. And there's a premium on good practice management. So where medical education and dental education is concerned, most of us feel that separate but equal education is always separate but not always equal. It was in this very room, I remember, several years ago when we had an American Student Dental Association meeting here. And after the meeting, a group of students said, "Can we speak to you?" I said, "Sure, you could speak to me." And they were grouped from various dental schools, and they came to see me about this problem. They said, when we go to have our basic science lectures, they're all given by the medical school faculty, and they all start in a similar fashion. "We don't understand why you need to know this." That doesn't happen here. And it means the difference between being educated here and being educated in other places, because the mouth is part of the body, and it's a gateway into understanding disease. Physicians also need to be educated about us and oral health. Just last year, Sang Park and some of our other faculty led a day where all 165 medical students and the 35 dental students in the second year class had a whole day devoted to how to examine the mouth, the neck, the teeth, and it had an effect, because now in history, when they learn to take histories, they all ask about oral health, medical students and dental students. I participate in OSCE exams for the second year medical students and dental students. They all examine the mouth, and it's not just looking at the pharynx, going right past the teeth and the rest of the structures. They really know how to examine the mouth, and I think this will make a difference. Why is this important? It's important because more than $1 billion is spent in emergency room visits for dental problems in this country. Huge, huge problem. And most physicians don't know what they're looking at. So you come in with pain here, before you know it, you have $300 worth of blood tests and a CAT scan. And then the problem is, where do you send that patient? There's no really backup for it. There are various plans that have been put into effect, but all the education in the world won't take care of taking care of the needs. It's estimated, and some of our own faculty have done these studies, that less than 3% of patients who are seen in emergency rooms nationally for oral health problems ever get them attended to. And most of the time, the way they're attended to is by removal of the offending tooth. We certainly have championed bringing the medical model into dental education. And there are new opportunities to change the scope of practice and engage dentists in primary care networks with increased interprofessional collaboration. On this education highlights, I think Sang Park and others, and Dr. Howell have championed a new case completion competency curriculum. It's patient-centered care. I opened a Journal of Dental Education last month, and two of the articles were Park and Howell, and Elizabeth Calendarian, all about safety and all about competency-based curriculum, how to use new educational models, which the new curriculum is going to use. We've been able to do the flipped classroom before the medical school, and this will be a new part of education where it's moving from problem-based education to education that the learner will have a responsibility to do certain things before they come to the classroom. And it works. We've had pilots running with this, and it really does work. We had the first international symposium on our educational methods last year, and there was another one this year. We've had the continuing education courses that we've been running have increased, and we're targeting certain areas. That is to say, implantology has been an important part of this, but this is not about crown making, it's about leadership. It's about being able to generate big ideas, and also about the importance of the medically compromised patient. Downstairs, if you get a tour, we opened just a few weeks ago our digital dental laboratory. Dr. Gallucci was instrumental, along with some others, in putting that together. So now, someone talked about robots before you know it, even I can make a crown that's milled by a machine, although I was good at crowns. New programs that have started. This July will be the initiation of a new DMSC research-only program that we're doing with the Forsyth Institute. And we've added the ability of our students to apply to PhD programs in economics and healthcare delivery, in addition to the PhD in biomedical science. And seeing Bjorn Olsen in the room, 3 students graduated yesterday and were hooded by him with PhDs in biomedical science. That program's now in its 11th year, and it's done very well. The other area of progress that we made is we established an Office of Diversity and Inclusion 2 years ago. This was really a directive by the University Visiting Committee to see if we could improve this. This was to broaden the applicant pool. This is headed by Peggy Timothy. I don't know if Peggy's in the room right now. She's done a wonderful job. She's also a senior tutor, and she became integrated with Ann Berg in the admissions committee and integrated with Joan Reed's office here at the medical school. We've had 2 Joe Henry Fellows supported by the dental school and the medical school. And this program has resulted in increased underrepresented minorities in the classes of the past 2 years. And this upcoming class, which consists of 35 students, was based on about 1,000 applications, interviews of 115 of those students, and we had to offer 41 spots to get to 35 students. And they're very good and very smart, and really see the profession in a very different way than in a lot of other applicants to dental schools. And I think that's a key to the continued strength of this institution, and that is to say, we do fill a certain niche for students who don't necessarily see their direct pipeline into a private office, but want to experience a a landscape where they have a little flexibility and more choices. Research remains an important area for us. The last time we looked, a paper was done that showed that we were 10th on the list of research support from NIH. Interestingly, only 14% of our grants come from the National Institutes of Dental and Craniofacial Research, since most of our strengths are in the area of bone biology and matrix biology, and some of the leaders in the world in those fields are sitting here, Bjorn Olsen, Roland Barron, I saw Vicki Rosen here, and Xi Ying, who just joined us from the NIH itself. Who did I miss? Nobody. So there certainly is a need for advocacy, and we've been trying to do that. But we've been holding our own on the research front because of hard work and new grants to a lot of these people, Malcolm Whitman and Yefu Lee. We just had Student Research Day, which was a huge success. There still is a research requirement. But we look on support of research as an investment, and Charles, I saw Charles somewhere, didn't I? Yes. Spent a lot of time on developing programs to support investigators who lose their funding for a period of time, to develop programs that will help reduce the cost of animal care and animal storage. And it's been a full-time job, but I think we're holding our own where that's concerned. Dr. Shigemi Nagai, who some of you heard at the session before on clinical research, continues to lead that. And as I mentioned, Dr. Ying-Se Yang, a renowned scientist, we're very happy has joined us, and we hope we know will make a big difference in our research programs. On the patient care front, the dental center faculty and student providers do health screenings for all patients, and so we do meaningful use, and this has become important. And I will tell you only one story since I'm a storyteller. I get a lot of letters as dean, most of them complaining about bills or appointments. But I had a letter from a patient not too long ago. I want you to know the following. I had a bad dental problem. I went from pillar to post, but I finally came in to see one of your endodontic residents. And while I was there, I was amazed because they weighed me and took my blood pressure and asked me a lot of medical histories. And my blood pressure was very, very high, and I didn't feel any different. And the resident asked me for my physician's name. She wanted to call him, and she did. And to make a long story short, the letter ended with, "This is the first time a dentist saved my life," because in fact he had severe kidney disease that was being expressed by hypertension, and it was picked up in the dental clinic. So this is important. The whole concept of easy codes to make diagnostic terminology part of the billing service has been pioneered by Elizabeth Kalandarian, the chair of oral health policy and epidemiology. The growth in pediatric dental clinic at Windsor Street, which is the Cambridge Health Alliance site, has really been astronomical, and Brian Swan and John Zdanowitz have done a tremendous job with that dental program, which really expresses our hopes to integrate oral health with primary care. We call it an oral physician primary care program. It's something we'd like to replicate in other areas, and have been in talks with both UMass Medical Center in Worcester and Dartmouth Medical Center and Red Logan Dental Clinic in Vermont and White River Junction to try and do this. Our students are very interested in these things. Jane Barrow, sitting in the audience, is our assistant dean for global and community health, and probably about 80% of our students do significant global and community health projects. The Bridges to Peace program is still active with schools both in Israel and El Quds, the Palestinian dental school. And outside, as you walk outside the door, you can see the sculpture, the Tree of Peace that we put up there last June 16th and had representatives of all these institutions here for that day. Unfortunately, it was followed by a small war, but that's what happens in this world. We've also been involved in something called Alliance for Oral Health Across Borders, which seeks to use oral health as a vehicle for getting disparate groups together. And one area we're looking at now is India and Pakistan, in terms of getting the countries together, in terms of the dental professions in those countries. I think one of the things we've now done for many years with King's College in London and the support of Colgate and Henry Schein is something called the Senior Dental Leaders Program. It was held here in March. We had 18 leaders of dentistry, deans, chief dental officers from around the world here. We had the dean from Haiti, whom we're helping to resurrect their dental program. And we had the dean from Rwanda, the school that we're helping them form their curriculum, and it's an interesting project. We've also been working with federally qualified community health centers to develop a patient-centered medical home. And I think I mentioned the primary care task force. We plan to introduce via a grant nurse practitioner students into our student dental clinic beginning this summer, so they work together. We want to, as I said, develop this oral physician residency program at other sites. This is the initiative I talked about, the initiative to integrate oral health in primary care. This was an idea generated by my advisory board. And so in October, we held this leadership forum called the Economic Imperative of Oral Health, Put Your Money Where Your Mouth Is. This was based on a number of studies showing that including dental benefits within primary health care coverage reduces overall health costs. Not only that, but improves the outcomes for chronic diseases. And although this data needs to be scrutinized and more of it needs to be obtained, it certainly is looking at the interrelationships of oral and systemic health in a way that hasn't been proved scientifically yet. Although you can show that oral microbes may be present on heart valves, although you can show that it may get into vessels. You may show that there are some organisms in atheroma of coronary artery disease. The kind of evidence that makes it causal has been missing, but this economic evidence is really quite interesting. And so we formed an initiative task force that now consists of 9 members, and this is a group that has put their money where their mouth is in the hopes of developing programs to attack this. And I will be speaking about this initiative in Washington on Tuesday to a national group of Medicaid and CHIP associations to see if I can drum up some interest. But it really is the idea of creating a movement. We had an interesting piece in the New England Journal in December, and we've had other kinds of publications in Inside Dentistry. And so this has really become something that we hope to take from an initiative stage to a center stage to an institute stage that could deal with delivery of health care, education, and interprofessional education and practice. Lots of honors. I probably left a lot out. Harvard Forsyth Krakow Research Fund awardees. Dr. Krakow traveled with our development team to the endodontic national meeting. Lisa Simon, a graduate of last year, was an American Public Health Association Rising Star Award winner. Jeff Wang, who just completed his DMSC, was a Hatton finalist at the IADR. We chose 4 new Dean Scholar in a program that's now in its 12th year, where we support young investigators making the transition from postdoc to faculty positions. And all but one of these has stayed in service in academic areas. One of our first year students won a TEDx. He's a TEDx Harvard finalist. He's developed an iPhone, mobile phone app that lets people manage taking their medicines better. And he's an interesting young man. On the staff honors and awards, Walter Gorelnik here in the front, won a Dear Guy's Award. Brittany Seymour was the inaugural recipient of a Global Health Fellowship. She's the new chair of the Consortium of Universities of Global Health Oral Health Group. I got an award for a Meskin Award. Peggy Timothy was a Michael Shannon Excellence in Mentoring Award. Floyd Dewhurst at Forsyth won a Distinguished Faculty Award in Oral Biology, and Bjorn Olsen was the 2015 Fellmuir Award from British Society for Matrix Biology. We also had an interesting session of department heads and deans. We've been dealing with a risk assessment survey with 29 areas to look at to assess our risk. The university is big on risk. We voted a couple of weeks ago, and these were the 6 that was thought by the members present to be of the highest order. Faculty recruitment and retention, and we made some changes in our policies that we'd have to finalize. The DMD curriculum, which I'll explain in a minute, is changing a bit. Financial aid, class size, trying to increase our class size by 5 pre-doctoral students, which has been approved by the University Visiting Committee, but just hasn't been possible to do with all the changes at the medical school. Assessment expense, which I think Charles Frizzell has taken care of very well, and the appropriate use of the Harvard name. In terms of strategy for the future, the most important things are we are looking forward to our 150th anniversary in 2017, and Nancy Jones will be putting together a committee that hopefully will include some alumni and staff to look at the kinds of things we want to do. The medical school curriculum reform has resulted in a compaction of the first 2 years into a little more than a year of foundations of basic science, but there will be both morning and afternoon, and so a lot of the courses that our students had in the afternoon that we gave them will have to move to the second year, so we're making some adjustments in that. Probably also have to look at when they start to meet their research requirements, which always took place in the summer after the first year, but now won't be free time. The other thing that we've been talking about with the primary care center at the medical school, and they're very interested in doing it, is putting a primary care medical practice here in the dental school. A number of the physicians there would like to practice here. And so there would be physicians and dentists and nurses and dental students and medical students and dental hygienists and dental assistants all practicing in a similar space. And we think it could be a very interesting model. And we're looking forward to doing this. And of course, last April, we launched the capital campaign, and Nancy, and she sent me the numbers, told me that to date, we're nearing $5 million in the $8 million goal. So thank you all very much. I think there's been some success. This is mainly designed for scholarships and fellowships, but we'll take what we can get. And so the rage these days is to name schools. So if anybody knows anybody who wants to name this school, we might consider it. I joke because the School of Public Health is now the T.H. Chan School of Public Health. And I also hear that someone is about to name the School of Engineering. But we shall see. Once again, this is my tenet that I live by. The key to reform of almost any kind in higher education lies not in the way that knowledge is produced. It lies in the way that the producers of knowledge are produced. And that's why dentistry and oral health being considered as a branch of medicine is important to our education and to our graduates. When I presented our graduates to President Faust yesterday, she welcomed them into a demanding branch of medicine. That's the way we believe it should be, and that's what this is all about. She said universities must be accountable to the future and I would add so much dental schools in the profession, and that at times is hard. You know, when you have a certain way of doing things, it's hard to change, but we must, and slowly but surely those changes are happening, and I think this institution has to be at the forefront of that. So I thank you for all your support. I'm sorry if I went over, but the state of the school is good, and you will have jobs.